Loves baby teeth, and I'm sure your child likes to lose their baby teeth, but how important are they? Because after all, you're a parent, they just fall out, right? Well, it turns out they are essential for many different reasons. Dr. David Harney and Jamie joining us from the Emerald Pediatric Dentistry today with some important information. And Dr. Harney, I'm sure that you guys have heard this at the dentist office. Well, we're not too worried about that because they're just going to fall out anyway, right?
All the time.
But that's not true. They're very important.
Yeah, baby teeth are important for several reasons, including aesthetics, chewing. They help guide our adult teeth into position, growth and development of our jaws and bone, and most importantly, space maintenance.
Okay.
Some of our baby teeth are present until a child is 12 to 14 years old. Ideally, we can maintain our baby teeth until they fall out naturally, but sometimes that's not the case.
It is always a big deal when a tooth starts coming loose in my house. Dad, look, it's going right here. Now, this is really just a parent question because I don't know. Should we encourage them to kind of, because they always want to start wiggling around, should we encourage that or be like, hey, just let it do its own, let it run its own course? What do we do?
I would say if it is wiggly, to go ahead and have the child, or you even wiggle it out. I've definitely wiggled out my son's teeth before.
Oh yeah, I'm becoming an expert. I got to tell you, I'm proud of Maisie on the last one. She did it. What do we do if a tooth is knocked out prematurely, like it's not loose, sporting event, kid loses a tooth?
If it is lost early, you probably want to do or have a space maintainer in there, and the doctor will suggest that.
Okay, what is a space maintainer? It sounds really cool.
A space maintainer is a simple device, simple appliance that is custom fit to a child's mouth.
Okay.
It'll hold on to the space from the baby tooth that was lost early.
Okay.
And it'll stay there until the adult tooth begins to erupt. Or the doctor decides that's a good time to remove.
Well, I've noticed, like, with our girls, most of the kids in school, Maisie was like, Dad, what's wrong? I'm not losing any teeth. Everybody in class. But that's pretty normal, right?
Yeah.
To keep it later, but there are some kids, they start losing them a little bit earlier. That's okay.
Absolutely.
Nothing wrong with that. All right. So if a baby tooth is lost too soon, the teeth beside it, if it goes too soon, it'll start tilting? Is that right?
It will. It will start actually moving or tilting. The teeth beside it will actually start to go in that space. And it's never a good thing because it can cause crowding later on.
I think probably a misnomer that a lot of parents have is in terms of like those cavities. Well, we'll wait till your regular teeth before we go to see the dentist. Let's let the regular teeth come in. Like that is like, no, do not do that at all, right?
No, you definitely want to come see us if you do have some issues.
There are people out there that really think it's okay. I mean, I remember growing up and like the dentist was not even an option. And we're like, but should we have teeth? We should see them, right?
Yes.
Typically, how often should we bring our kids into the dentist?
Every 6 months for their normal cleanings.
Okay.
There are some times where we do suggest 3-month cleanings, though.
We were talking about losing teeth and those space maintainers. Those are pretty important. So pretty much as soon as they lose that tooth, if it's prematurely and there's nothing growing in there, get those space maintainers in.
Absolutely. And at Emerald Pediatrics and Orthodontics, we actually have an in-house lab. That way we're able to fabricate our space maintainers quickly and efficiently, and sometimes even in the same day.
Really?
Yeah, it's a service that we love being able to provide for our patients.
Yes.
Doctor, what would you say is probably the one thing about pediatric dentistry that most people don't know or get wrong when it comes to dental care for kids?
Baby teeth aren't important. And that they're going to fall out quickly.
Yeah, it's not just an excuse to get the tooth fairy involved and drop a couple of coins underneath the pillow, but it is to maintain that on a regular basis. So what do we need to do in terms of getting our kids in? How can we reach out?
Just call the office. We have appointments any time of the day. Just come and call. I mean, we're always willing to get you in as soon as possible.
And in terms of orthodontic care, just kind of while I have you guys here, how early should we start thinking about orthodontic care with the kids?
We like to usually screen as early as 7 sometimes, but we definitely want to see you by 10 years old just to make sure that everything is A-okay.
Absolutely.
Yeah.
And Doctor, I guess the earlier we catch kind of some of that, the easier it is on the kid and the quicker we can kind of correct that.
Absolutely. It's always good to catch things early on. to avoid problems down the road.
Well, very good. Well, we bring our girls in. We absolutely love it. The atmosphere there, you guys take care of us, and we appreciate it. So if you've got some dental care needs, APDO can absolutely take care of you. Got a couple of different locations. This one off of Sonsi. And I got to ask you while you guys are here, what's the update on the construction? Everywhere I look, I see a sign and everything's going up. What's the update?
We're told that it's going to be done by the end of June, and so that's what we're anticipating.
But in construction terms,
yeah,
about 2 weeks
we'll
out.
see. Maybe September.
All right, guys. Well, I appreciate it. Thank you so much for coming in. Stay tuned. Crispy veggies and Hope Springs crackers sound like a perfect pairing, right? We're in the kitchen after this short break.